Good afternoon, everyone, and thank you for joining our briefing on the City of Philadelphia's response to COVID-19. We will begin our briefing today with opening remarks from Mayor Kenney. Mayor, you have the floor.
Thanks, Mike, and good afternoon, everyone. Yesterday marked 50 days until the November election. Many residents have written to us to express their concerns over having a safe and secure election this fall. Earlier this month, the City Commissioners announced the receipt of a $10 million grant from the nonpartisan nonprofit Center for Tech and Civic Life to help run a safe, smooth, and secure election this fall in the midst of the ongoing COVID-19 pandemic. The grant will provide funding to the city to support upgraded equipment for processing applications and ballots, more timely reporting, and 17 satellite election offices for in-person, on-demand mail-in voting. The funds will also help pay for PPE training and other support to ensure safe and accessible polling places on election day. Funding will also provide support for drop boxes and relevant security needs and cover the costs of printing and postage costs to inform and educate voters about options for voting. Voting is one of the most important things a U.S. citizen can do. Our city benefits when everyone makes their voice heard. We're working closely with the city commissioners to make sure the election is safe and secure and that Philadelphia voters know what voting options are available to them. Together, we can ensure that every eligible voter in Philadelphia is able to cast their vote. November 3rd will be here before we know it. We encourage residents to register to vote and make a plan now, whether voting by mail or in person. Another equally important task that Philadelphians can do is take part in the census. Philadelphia City Council proclaimed this week as Census Week to promote census completion in the city. While some areas of Philadelphia have filled out the 2020 census at rates similar to the 2010 census, some neighborhoods are still quite behind. There are real implications for our city if we don't get a complete and accurate census count. In the 2020 census count, if just one person is missed, Philadelphia would face the loss of about $21,000 in federal funding over the decade. If an undercount occurs, the city's capacity to meet the needs of all its residents will be seriously impacted. Residents will have until September 30th, 2020 to fill out the census online, over the phone, and via paper form. So if you haven't already done so, please do it now. Just go to 2020census.gov. That's 2020census.gov. And now Dr. Farley for his update.
Thank you very much, Mayor. I have good news today on our case counts. Here are the numbers. Since this time yesterday, we've identified 84 new cases in Philadelphia residents of the coronavirus infection, bringing us to a total of 35,340 since the beginning of the epidemic. Now, for the past week that ended last Saturday, September 12th, by the date in which the test was run in the laboratory, we were averaging 67 cases per day over that week. And of those people who were tested, 2.6% were positive. Now, there are delays in case reporting, and those numbers are likely to increase in the next few days. But still, the average daily case count and the percent positive is the lowest we've had since the first week of the epidemic back in March. That's really good news, a sign of real good progress, and it's a credit to all the things that people in the city of Philadelphia have been doing to try to prevent the spread of this infection. Of those cases we have reported over the past few days, about a quarter have been in college-aged people. And that's representative of the fact that colleges are places where we're having outbreaks across the state and across the nation, as well as here in the city. They're the biggest source of increases in this case counts across the nation. Since this time yesterday, we've identified one additional death from the coronavirus infection. Our total is 1,771 since the beginning of the epidemic. Our data comes in batches, but we're averaging about one death per day or about 7 per week. Now, you may have heard this morning or yesterday afternoon the report that a federal judge in Western Pennsylvania struck down the governor's stay-at-home order and the gathering limits that the governor put in place. Now, the governor will appeal, but here's what's important for people in the city of Philadelphia. This order does not affect the safety orders that the city of Philadelphia has enacted. Those have been enacted through mayoral order. That includes our restrictions on restaurants, our limits on activities and other settings, and our limits on gatherings. So nothing is going to change in the city of Philadelphia as a result of that court ruling. Just a reminder, though, about those restrictions. As of today, the limits on our outdoor gatherings is going to change from 50 to 150. That's because we do think that outdoor gatherings are safer than indoor gatherings and because our case counts are lower. But still, people do need to remember that the virus is spread by droplets. So when people are outdoors, you still need to have a 6-foot distance from other people. And the virus can still spread from one person to another through the air, even outdoors. So people still need to wear masks outdoors. And that means that if people are doing gatherings that involving food and drink, or people are not masked, that's still risky. So we recommend that when people gather outdoors, that they avoid serving food and drinks. Now let me talk a little bit about mask use. We are still doing observations to measure mask use in Philadelphia. As of last week, among people who were leaving retail stores, 85% of those that we observed were wearing masks. And that percentage fluctuates from week to week. The week before that, it was 96%. It's still in a very high range. Among people who were outdoors in commercial areas, the number is 69%. Now, that percentage includes any mask use, even if people wearing their masks incorrectly, like if they're covering their mouth but not their nose. Today, a group of independent researchers released a report of their own observations here in Philadelphia. Now, they did their observations outdoors only, so there's no information about what people are doing indoors. The outdoor locations that they did their observations in were commercial streets, neighborhood parks, and playgrounds. They did it in August, and they observed about 4,600 people over that few-week period. What they found was that on commercial streets, 72% of Philadelphia's residents were wearing masks at all, and 51% were wearing masks correctly. And that's similar to our data on any mask use on commercial streets. They're both about 70%. They found, though, that there was lower mask use among people in parks, 56%, and in playgrounds at 36%. Now, these researchers, when they looked at people, guessed their age, their race, and their sex, and they recorded differences in mask wearing by those demographic factors. And here's what they found, was that younger people were less likely to wear masks than older people, and men were less likely to wear masks than women, 54% for men versus 67% for women. They found differences by neighborhood across the city, and they found differences by race and ethnicity of the person that they observed. Whites were wearing masks 61% of the time, African Americans 56% of the time, and Hispanics 48% of the time. To me, this is the key message, is that most Philadelphians are doing the right thing most of the time, but we all need to wear masks more regularly, and we need to wear masks more consistently, even if we're outdoors when we're near others. And everyone needs to wear masks correctly. So because of that, today we're going to be releasing a flyer to educate people on better mask use. I thought I'd just talk a little bit to summarize the messages in that flyer. First, the flyer talks about the materials of the mask that you might want to use. The idea is you want a material that will filter droplets in the air. That could be a commercially produced medical mask, this one here that I think of as a paper mask, but it's actually made out of polypropylene. These are something you can easily buy at a pharmacy in the city. Or it could be a cloth mask that has a tight weave or double ply, 2 layers to it, like a cotton mask. You shouldn't be using loose knit materials. Those would be materials where if you hold it up to the light, you can see big gaps between the different fibers. So you want one that has a finer mesh so that it filters droplets in the air. Then there are other aspects of the construction of the mask that can give you more or less effectiveness to this. What you want is a mask that will make a good seal along the bridge of the nose and the cheeks and down around the chin so that none of the droplets can go in or can go out. One way to achieve that is through a flexible metal stay that bends over the bridge of your nose. Like this one here, you can't see it well, but this has a little kink in it. That's where the metal stay is within the mask. This is a KN95 mask, and you might be able to see the piece of metal there. You can bend over the bridge of your nose. Or another way to do that is to have the mask be elastic so that it can be pulled tight across your cheeks. You also want the mask to have stretchy ear loops, like you see here, so the mask can be pulled tight to your face. You don't want to use bandanas or masks that are loose below your mouth because then droplets can go in or they can go out. You don't want to wear a mask that has valves. Now, there are masks out there that are for sale that are valves. Those are designed for construction. What they do is they prevent the user from being exposed to dust when you're working at a construction site, but they don't prevent water droplets from going out. So you shouldn't be using those to prevent the spread of COVID. The flyer will also talk about how to wear a mask. The basic principles are pretty clear. You should cover your mouth and your nose. It doesn't do any good to have the mask cover your mouth only or to have the mask down here on your neck. To state the obvious, you don't breathe through your neck. And this is something I see frequently and it really bothers me. Don't pull your mask down to talk to the person next to you. When you're talking to the person next to you is when you're most putting out those water droplets. That's the most important time to have a mask on. The flyer will also talk about how to wear or when to wear a mask. You want to wear the mask whenever you're indoors with persons other than your household members. And you want to wear a mask whenever you're outdoors within 6 feet of people other than your household members. Now, in general, I believe that a lot of the progress we've made of this epidemic is because people are wearing masks. So we're really making a lot of progress. So if you're wearing a mask at all, thank you very much. But now that most people have made that change, it's time to wear the right kind of mask and to wear them more consistently. Thanks very much. And more information is all on our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. And now Armanda will present the Spanish language translations of the mayor's and Dr. Farley's comments.
Palabras del alcalde Jim Kenney para el 15 de septiembre del 2020. Buenas tardes. Ayer se marcaron 50 días hasta las elecciones de noviembre. Muchos residentes me han escrito para expresar su preocupación acerca de tener unas elecciones seguras este otoño. A principios de este mes, los comisionados de la ciudad anunciaron que recibieron una subvención de $10 millones del Center for Tech and Civic Life, una organización no partidista y sin fines de lucro para ayudar a llevar a cabo una elección segura y sin inconvenientes este otoño en medio de la pandemia del COVID-19. La subvención le dará fondos a la ciudad para obtener equipos mejorados para procesar solicitudes y boletas, para emitir informes más oportunos y para montar 17 oficinas electorales satélites para la votación por correo en persona a solicitud del elector. Los fondos también ayudarán a pagar los artículos de protección personal, la capacitación y otros tipos de apoyo para garantizar lugares de votación seguros y accesibles el día de las elecciones. Este financiamiento también cubrirá los gastos de seguridad, buzones seguros, costos de impresión y envío postal para informar y educar a los votantes sobre sus opciones para votar este otoño. El votar es una de las cosas más importantes que pueden hacer los ciudadanos estadounidenses. Nuestra ciudad se beneficia cuando todos hacen oír su voz. Estamos trabajando en estrecha cooperación con los comisionados de la ciudad para asegurarnos que la elección sea segura y que los votantes de Filadelfia sepan acerca de las opciones disponibles para su votación. Juntos podemos asegurar que todos los votantes elegibles en Filadelfia puedan emitir su voto. El 3 de noviembre llegará antes que nos demos cuenta, así que les alentamos a los residentes a que se registren para votar y que hagan un plan ahora, ya sea para votar por correo o para votar en persona. Otra tarea igualmente importante que pueden hacer los habitantes de Filadelfia es participar del censo. El Ayuntamiento de Filadelfia proclamó esta semana como la Semana del Censo para promover que los residentes de Filadelfia lo completen. Si bien algunas áreas de Filadelfia han completado el censo del 2020 a tasas similares de las del censo del 2010, algunos vecindarios todavía están bastante atrasados. Hay implicancias reales para la ciudad si no obtenemos un censo completo y preciso. El conteo del censo del 2020, si solo falta una persona, Filadelfia podría enfrentar una pérdida de $21,000 en fondos federales durante una década. Si ocurre un conteo insuficiente, la capacidad de la ciudad para satisfacer las necesidades de todos sus residentes se vería seriamente afectada. Los residentes tendrán hasta el 30 de septiembre del 2020 para completar el censo en línea, por teléfono o en papel. Entonces, si aún no lo ha hecho ya, hágalo ahora. Simplemente vaya a 2020census.gov. Solo le tomará menos de 10 minutos. Gracias. Y esta es la actualización en materia de salud para el día 10 de septiembre del 2020. Hoy comenzamos con buenas noticias, con un conteo menor de los casos. El día de hoy reportamos 84 nuevos casos con un total de 35.340 casos reportados en total. La semana pasada, finalizada el 12 de septiembre, tuvimos en promedio 67 casos diarios. El 2,6% de los casos resultaron positivos. Ha habido retrasos en la entrega de los resultados, lo cual podría incrementar el número de casos diarios. Pero ambos, el promedio de casos positivos y el porcentaje de casos, ha sido uno de los más bajos desde el mes de marzo. Un cuarto de los casos se dieron en individuos en edad universitaria. Si no hubiese sido por los casos asociados al inicio de clases en las universidades, el conteo de casos habría sido aún menor. Los brotes de casos en las universidades continúan en los Estados Unidos, y esta es ahora la mayor fuente de contagios a nivel nacional. El día de hoy reportamos una muerte por el COVID-19. En total, 1.771 personas han fallecido en Filadelfia a causa de este virus. Hemos recibido nuestros datos en grupos. En los últimos 7 días el promedio es de una muerte diaria. Respecto al caso pendiente ante los tribunales federales, como bien sabrán, un juez federal anuló la orden estatal de quedarse en casa y los límites de asistentes a reuniones. Sabemos que el gobernador va a apelar esta decisión. Sin embargo, esta decisión no ha afectado la orden de mitigación del gobierno en cuanto a los límites para los restaurantes. Tampoco afectó las órdenes de seguridad de la alcaldía de Filadelfia en la ciudad en cuanto a las restricciones para los restaurantes, los límites para las actividades y los límites para las reuniones. Hay un recordatorio. A partir del día de hoy aumenta el número de personas que se permite para las reuniones al aire libre a 150 personas. Pero ante todo hay que recordar que el virus se propaga por gotitas o secreciones, por lo que aún es necesario mantener una distancia de 6 pies. Y que el virus puede propagarse a través del aire, incluso al aire libre, así que utilice una máscara al aire libre también. Esto significa que las reuniones que conllevan comida y bebida, en las que las personas no usan mascarillas, siguen siendo peligrosas. Sobre el uso de las mascarillas, les recomendamos que cuando las personas se reúnan al aire libre, eviten comer y beber. Todavía estamos monitoreando el uso de mascarillas y durante la semana pasada hemos visto que las personas que salen de las tiendas minoristas las usan en un 85%. Esto ha bajado de un 96% en la semana anterior. En cuanto a las personas al aire libre en las áreas comerciales, estas utilizan la mascarilla al 69%. Esto incluye cualquier uso de la mascarilla, incluso si es un uso incorrecto, tal como cubrirse la boca sin cubrirse la nariz. Hoy, un grupo de investigadores independientes publicó un informe con respecto a sus propias observaciones en Filadelfia. Este estudio fue solamente respecto al uso de mascarillas en exteriores. Ellos observaron a 4.600 personas en las calles, parques y áreas de juego el mes de agosto. En las calles con comercios, un 72% utilizó la mascarilla y un 51% la utilizó correctamente. Estos números son similares a los nuestros datos sobre el uso de mascarillas en las calles comerciales, ambas alrededor del 70%, menor en su uso respecto a los parques en un 56%, menor aún en las áreas de juego en un 36%. Ellos computaron la edad, la raza, el sexo y registraron diferencias en el uso de las mascarillas. Los más jóvenes tienden a usar las mascarillas en menor proporción. Es menos probable que los hombres utilicen las mascarillas que las mujeres, en un 54% comparado a un 67%. Las diferencias de uso también se ven por diferentes zonas de la ciudad. Hay diferencias en el uso de la mascarilla respecto a raza y etnia. Los blancos en un 61%, los afroamericanos en un 56% y los hispanos en un 48%. La mayoría de los habitantes de Filadelfia hacen lo correcto, pero todos debemos utilizar las mascarillas porque es nuestra responsabilidad. Utilice las mascarillas constantemente, incluso si está usted al aire libre o cuando esté cerca a otras personas. Por favor, utilice las mascarillas adecuadamente. Estaremos repartiendo un folleto informativo para un mejor uso de las mascarillas. En cuanto al material, hay que recordar que es importante que retengan las secreciones y las gotas en el aire. Por eso es importante utilizar bien las mascarillas. Las mascarillas que se recomiendan son las de uso médico, de polipropileno o las de doble capa de tela, como el algodón. Las mascarillas no pueden ser tejidas. En cuanto a la elaboración, tienen que ser lo suficientemente grandes para cubrir la nariz, las mejillas y el mentón. Deben tener un soporte de metal flexible para que se pueda doblar sobre el puente de la nariz. La máscara debe poder ajustarse a su cara. No es recomendable el uso de pañuelos o bandanas sueltas debajo de la boca, porque deben de cubrirse la nariz y la boca. ¿Cómo usar correctamente la mascarilla? Nuevamente, debe de cubrir la nariz y la boca. La mascarilla no sirve para nada si le cubre solamente el cuello. Por favor, no se quite la mascarilla al hablar con la gente. Cuando use la mascarilla, que sea siempre en espacios bajo techos, cuando tenga personas que no sean de su hogar. Siempre que se encuentre al aire libre y a menos de 6 pies de distancia. Así que juntos podemos ganarle al COVID. Cuida de ti y de tus seres queridos, así que usa una mascarilla. Muchas gracias.
Thank you, Armando. We're now going to move to the Q&A portion for members of the media, and thank you again for joining our briefing on topics related to the COVID-19 pandemic. Also joining us today is Acting Managing Director Tumar Alexander. The first round of questions, as we do each day, is limited to COVID-19, including matters related to yesterday's court ruling. And joining us for any questions on that ruling is City Solicitor Marcel Pratt. If you have questions on any other topics, including the protest camps on the Parkway and Ridge Avenue, please hold them for the second round of questions. And joining us for any questions on that topic is Deputy Managing Director Eva Gladstein. Your hand is raised now and your question is not on COVID-19 or related topics. Please answer it, and we will announce the second round when we get to it. Thanks. Only one representative from each media outlet is permitted to ask questions, and we, as usual, are asking you to limit your questions to 3 or fewer. And now with that, we now go to Eamon Crespo of Telemundo.
Hola, esta pregunta es para el City Solicitor sobre la orden del juez federal. ¿Cómo piensa la ciudad de Filadelfia hacer valer esta orden, ya que estamos hablando de un juez federal? ¿Qué medidas se tendrían que tomar?
This is a question for the city solicitor in regards to the order issued by the federal judge. How is this order validity going to be implemented is the question.
So here in Philadelphia, as the health commissioner said earlier, it does not impact the orders that we've issued. So those are still in effect. They are still lawful. The order from the Western District of Pennsylvania, that's where the federal court is limited to the governor's order. And again, it doesn't impact us. That's the simple answer. So all of the restrictions that we've put into place are still valid and have to be followed.
La respuesta es que esta orden del juez no tiene un impacto con las órdenes y las ordenanzas que se han emitido a nivel local, porque estas órdenes que han sido emitidas por un juez federal en el distrito oriental de Pensilvania, del oeste de Pensilvania, solamente limitan las órdenes del gobernador, pero las restricciones que hemos implementado a nivel de la ciudad siguen vigentes.
Y la siguiente pregunta es el mismo tema, pero ¿qué pasa entonces con los negocios o las personas que consideren que esto es inconstitucional, mejor dicho? ¿Qué va a pasar entonces si esto sucede aquí en Filadelfia?
The same topic for the next question. What about the people and businesses who find that this is unconstitutional? What's going to happen then?
So again, here in Philadelphia, our rules are still in effect, and they are constitutional, and we'll continue to enforce them. I think in terms of the governor's order and how he plans to enforce it going forward, that's a question for the governor, but they are appealing that decision and seeking a stay. As he announced earlier, but. Again, in Philadelphia, the rules are still in effect. They're constitutional, and they have to be followed.
But I also think, as an aside, it's interesting that the Trump administration, through this whole pandemic, has abdicated any responsibility, has told both governors and mayors that it's all on them, and then a federal judge appointed by Trump that invalidates the governor's ability to do it. It's totally bizarre and just par for the course for this bizarro last 4 years we've been going through.
La respuesta es que las reglas siguen en efecto en la ciudad porque son constitucionales y nosotros vamos a seguir haciéndolas cumplir. Estas órdenes, con respecto al gobernador, sin embargo, dependen de cómo él enfrenta y qué planea él hacer. Sabemos que él va a presentar o ha presentado ya una apelación pidiendo que se pare esta orden judicial y en Filadelfia nuestras reglas van a continuar haciéndose respetar. El alcalde indica en un comentario paralelo de que es algo paradójico que la administración del presidente Trump, que ha renunciado a su responsabilidad de liderar en medio de esta pandemia, delegando esa actividad a los gobernadores y a los alcaldes, tiene ahora un juez federal que ha sido designado por el presidente Trump, que ha invalidado estas actividades y estas legislaciones o estas restricciones, pero nosotros vamos a seguir continuando con ello mientras estamos enfrentando estos momentos tan bizarros y tan extraños en nuestra vida. Adelante.
Muchas gracias.
Thank you very much.
Thank you, Yaima. Let's go now to Walter Perez of 6ABC. Walter, you'll have to unmute yourself there.
Okay, how's that? Sorry about that.
That works.
My question is, is there any issue, or has there been an issue with people complying with safety regulations on federal property in the city? Something like Independence Mall, if someone goes to see the Liberty Bell. I'm not even sure if there's an issue there, but has there been, and is there one?
I'm not aware of any particular complaints. I assume that the same level of participation in mask wearing and distancing that Dr. Farley talked about in his opening remarks, I assume applies to a place in Philadelphia. I don't know why the federal facilities would be different unless there's people visiting again from out of town, which is not likely because we don't have a lot of people visiting these days. So I don't know if Dr. Farley has an opinion.
Yeah, there was an article in the paper this morning about that. So the mask order that the mayor signed holds for anybody in any facility, including a federal facility. People are required to wear masks. What's happened is that the federal workers there have been told that they cannot enforce the rule because of federal ruling. I'm not clear on how many people are not wearing masks. Certainly, the mayor's order applies. People need to wear masks in those facilities, and we hope that most people do that.
Walter, you're still muted there. There you go.
I apologize. Thank you. That's all I wanted.
Okay, very good. Thank you, Walter. And let's go now to Carolina Rodriguez Plaza of Univision.
Hi, everyone. Can you hear me?
Yes.
Hola, buenas tardes, Armando. Voy a necesitar tu ayuda.
Como no, Carolina, mucho gusto.
Gracias. Tengo una pregunta de seguimiento sobre el tema de la declaración de inconstitucionalidad del juez federal ayer en Pensilvania, directamente para el alcalde Kenny, por favor. Quiero saber si el alcalde entiende que esto se trata de una movida política, tomando en consideración que el presidente Trump se encontrará esta tarde en Filadelfia y que Pensilvania ha sido un estado clave en la campaña política. Si esto tiene una razón de ser más allá de un elemento político en medio de la pandemia.
Más allá de un elemento, digamos, judicial, para un elemento político.
Si se trata solamente de una movida política en medio de la pandemia y tomando en cuenta de que Trump está hoy en Filadelfia.
This is a question for Mayor Kenny. Mayor Kenny, this decision about the inconstitutionality of the governor's actions and the order issued by the judge, do you consider that this is more of a political move? Because the President Trump will be in Pennsylvania and Philadelphia specifically this afternoon, being that Pennsylvania is a key state. Do you think that beyond the judiciary, this is more of a political move?
Well, first of all, I'm not going to second guess the judge's motives. I don't know about the case. Haven't heard any of the arguments, and we'll take the judge at his word. It just is interesting that he was appointed by this president. So I don't know if there's any specific political motivation to it on Trump's visit. I don't know how long this visit has been planned, but I assume the case has been going on for a little while now. So I wouldn't draw the two together. The only reason I made the connection was because it was the president who wanted the governors and mayors to take care of it, and one of his appointees undid it, or is trying to undo it.
No voy a tratar de adivinar cuáles han sido las motivaciones de este juez para emitir esta orden. Es interesante, sin embargo, fuera del hecho de que haya una motivación específica planificada, porque esta es una visita que se había programado con anticipación. Lo que sí quería hacer, sencillamente, en mi comentario era un paralelo al hecho de que el presidente fue quien delegó esta actividad a los gobernadores y a los alcaldes y ha sido un designado por él como juez quien ha tratado de deshacer esto. Es todo.
Thank you very much, Mayor. Gracias, Armando. That's all I have.
No, muchas gracias. Thank you.
Thank you. Let's go now to Sean Walsh of the Inquirer.
Thanks very much. Real quick, Dr. Farley, could you repeat the average case count over the previous week ending Saturday that you said was the lowest since the beginning of the pandemic?
67 cases per day for the last week. That's through last Saturday by the date in which the test was run.
Thanks. And is that lower than the first week of the pandemic, or is it second only to the first week of the pandemic?
I'd have to get back to you. It may be
Okay.
second to the first week of the pandemic.
Gotcha. And then, Dr. Farley or Mayor Kenny, when the Eagles have their home game on Sunday, does the city plan to, discourage folks from congregating outside the stadium like some have for Phillies games? Will there be any closures of streets down there?
We'll have more for you later this week as we get closer to game day. There will be no tailgating down there. I believe that we're working with the Eagles and some of the property owners down there that have traditionally been locales for tailgating to keep that from happening, locking the gates of the parking lot. FDR Park will not be permitted to tailgate in there. So we're just trying to keep people safe. I recognize as a long-term rabid Eagles fan myself, there's nowhere else I'd rather be than in the parking lot tailgating, waiting for the 1:00 game. So, we just need to keep each other safe, and there will be other football seasons, and hopefully we can all go back down and enjoy it again.
Thanks. And then I have a non-COVID question. Should I keep that for the second round?
Yes, if you could, that would be great. We are still on the first round and questions pertaining only to the COVID pandemic. So let's move now to Martin Pratt of Philly YVN.
Yes, this first question is for the city solicitor. Can you explain a little more in detail the difference of why that this does not apply to this order from the federal judge doesn't apply to Philadelphia, but we were required to follow whatever Governor Wolf said?
Sure. So first and foremost, the city was not a party to that case, so it's not bound by a decision in that case. But more importantly, the city issued its own orders along the way and mirrored some of the restrictions that the governor had implemented or imposed additional restrictions on top of those. So the way to think of it is we have sort of our own separate body of restrictions that were not examined and remained untouched by this decision. Does that make sense?
Yes, it does. Does the city expect to enjoin an appeal of this order or from the federal judge?
We're certainly evaluating how we can best support the governor. We do disagree with the decision by the judge. So we're still evaluating how we can support, but we believe the governor acted constitutionally, and we'll support him.
Okay, thank you. Second question is for Dr. Farley. Dr. Farley, you talked about proper use of wearing of masks. Was there any data in there that talked about how many times I see it often where people are wearing the mask over their mouth, but their nose is still exposed?
There is some data that the researchers, the independent researchers have, I don't have it in front of me, that talks about different types of not wearing it properly that may get at that. And I do think that's a common problem, which is why I wanted to raise that.
And lastly, Dr. Farley, is there any news or updates on wastewater epidemiology? I've seen it being used all over the place now as a regular thing to really attack the college issues.
There isn't any, and I will check and get back to you.
Thank you.
You good, Martin?
Yes, I am. Thank you.
Right. Let's go now to Alan Yu of WHYY. Alan, can you unmute? There you go. You're unmuted.
Hi. Can you all hear me?
Yes, we're good.
Okay. First question is for Dr. Farley. We like to ask how the effort to offer resources to people who have challenges isolating or quarantining at home is going. Are people taking advantage of those resources?
There are a small number of people who are taking advantage of those resources, maybe not as many as we would like. I don't have hard numbers, but it's a small number. Definitely, most people prefer to isolate or quarantine at home. That much is clear.
You're still muted.
Alan, can you unmute yourself there?
Hello?
Yes, go ahead.
Okay, great. It didn't allow me to unmute myself, but okay. Dr. Farley, any thoughts or plans to further outreach, or do you think it's a problem of outreach or problem of like people just preferring to stay at home? Are there, for example, people who cannot isolate at home but just haven't been reached yet?
It's hard to say. We do have individual conversations with people. We tell them we have resources to offer them. I have not heard people. It's not been reported to me that people are saying, "Well, I would isolate somewhere else if only you give me X and we needed to supply X." Most people just prefer to do that. Nonetheless, we're going to keep trying. If we find that people are isolating at home in a way that's really not safe, we're going to try to encourage them and see what other things we can do that would make it easier for them to isolate elsewhere.
Okay. One last question about mask use. Any cooperation from your department or the city to work with, say, police officers to make sure that, city staff also wear masks properly?
So you may have to talk to other city representatives on that issue.
There's no plans at the moment, but that question falls into the category of what police should actually be doing on this whole entire conversation we've been having over this really difficult spring and summer. Should officers be employed to or empowered to or asked to, police people's mask wearing? I mean, these are the questions that we have when we talk about police reform. These are the questions we need to go through and not lay everything in the lap of the police.
Are you all set, Alan?
Sorry, maybe I should clarify. I was asking about cooperation to make sure that the officers themselves are wearing masks properly.
I'm sorry. I misunderstood. I believe they're directed to do so. And we encourage them to do that also because they come in contact with folks. I thought you meant using them to enforce mask wearing. No,
that was not, but I can understand how that could be confusing.
Okay. I don't have any data on, I generally see police officers wearing masks. I guess if they're eating lunch or something or not, but I don't have any type of hard data to give you.
Got it. Thank you.
All right. Thank you, Alan. Let's go to Alicia Reed of CBS 3.
Hi, good afternoon. Thanks for taking my question. This is for Tumar Alexander. Can you give us an update on where we are with trash delays? Have we rounded the curve or we're closer to being back to normal? We spoke to some residents who are saying they're seeing an increase in pests and rodents because of trash backup.
Let me just jump in real quick. I mean, my understanding of the increase in rodent activity has as much to do or maybe more to do with restaurants had not been open for quite some time. And the flow of food supply for them made them a little more aggressive and made them come out more in the open than they would be. But I think, and Tumar can bring us up to date on up to speed on the exact situation. But from what I understand, trash pickup is back on schedule.
That's correct, Mayor. And Alicia, if we encourage folks who may be having issues with rodent to call and report them to 311, so we can have our health department sort of go check that out. So I'll go back and see if I could pull any 311 calls, or if you want to give us more information regarding particular areas that we could address.
Okay, sure thing. My second question is for round 2. Can I go ahead and ask right now?
Yeah, in fact, there are no other hands raised.
Okay.
So your timing is perfect, and we will now go to round 2 and open the floor to questions on other topics.
Perfect, thank you. So, Mayor Kenny, are there any security precautions that the city will be taking for President Trump's arrival?
Yes, we've beefed up our patrols. We've locked down certain areas in cooperation in conjunction with Secret Service. A number of one large protest and a few other smaller ones that we need to monitor and take care of to make sure that people can express their First Amendment rights and be safe. It's certainly not something we were looking forward to doing, considering all we've been through in the last number of months. But presidents come to cities based on lots of reasons. The other thing that's a little frustrating is it costs us a lot of money, and we're not reimbursed for it. And it does have to reorder our police presence in areas where normally they wouldn't be as heavily needed.
Alicia, you're still muted. If you can unmute yourself again.
Okay, thank you so much. I appreciate it.
You're all set? Okay.
Thank you.
All right, let's go back to Sean Walsh of the Inquirer.
Thanks very much. Mayor Kenny, the president is coming into town today at the Constitution Center for a town hall. Voters are going to be able to ask questions of him there. What question would you ask the president if you were in the audience?
I don't really have, I'm beyond questions at this point.
Or any message for the president as he's coming into town?
No.
Nothing?
Nope.
All right.
Anything else, Sean?
No, that's it.
Okay, let's go back to Yaima Crespo of Telemundo.
Esta pregunta es para el alcalde, si Armando la puede traducir, y básicamente la pregunta que le tengo es ¿qué va a pasar con las negociaciones entre el encampment y la alcaldía? ¿Va a haber algún tipo de reunión?
This question is from Mayor Kenny. The question has to deal with encampment, and Yaima is wondering what negotiations are going to be taking place, what's going to happen next in that regard.
Well, we're certainly not going to disclose when we decide to move the camp. We're trying to, because that would not be in the best interest of the people, the officers who have to go in and do the work. But we're in discussions with them all the time. Our homeless outreach people are out there all the time. Every day we placed 144 individuals into safety and shelter. But this is public land. It is a park, and it's available. It should be available to everybody, not just a small number of people. And we'll continue to be sensitive to the issue. We understand we're in a very sensitive environment based on the past number of months. But at some point in time, as I've said before, it's going to have to end, and we're trying to get as many homeless people out of there before we do anything.
No voy a revelar en estos momentos nuestras actividades para la transferencia de estos ocupantes del campo, porque no va en los mejores intereses de nuestros oficiales y las personas que están atendiendo sus necesidades. Pero nosotros estamos ahí constantemente, estamos teniendo conversaciones perennes con ellos. Tenemos también a nuestro personal que está tratando de acercarse a las personas sin hogar y a las personas que necesitan cuidado y tratamiento alternativo. Hemos podido retirar a 144 personas a albergues seguros, pero hay que recordar de que esta es propiedad pública. Es un parque para que lo disfruten todas las personas, y pese a que estamos teniendo conversaciones y este es un tema delicado, va a llegar el momento en el cual esto va a tener que acabar. Vamos a tener que evitar tener más de esta situación en nuestro futuro.
Todo. Muchas gracias.
Thank you very much.
Yaima, thank you. And Pat Loeb of KYW has technical issues, so she put her question into chat. This is for Tumar Alexander. She asks if recycling is being processed or is being incinerated with the trash.
Like, I believe it's being processed. It's being processed, but I'll get back to you with a certain answer on that.
Okay, Pat, if you don't mind shooting us an email, and we will get back to you. And we see no further questions. So,
Mike, there is a question in the chat from Tom McDonald.
Oh, you are right. Tommy, I guess, also is having technical issues. He asks to Dr. Farley, who did the independent mask study, and is the data available to be sent out?
Yes, the data is available to be sent out, and it was done by a group of researchers representing different institutions. I've got in front of me, there's an organization called Studio Ludo, then Kaiser Permanente, San Diego State University, and the RAND Corporation. Several researchers from this, several different institutions.
Very good. Thank you. And Martin Pratt, he says you have one question. You want to raise your hand there, Martin? I'm not seeing you. Martin, you're up.
Yes. Okay. Can you hear me?
Go ahead.
Sorry, having technical difficulties also. Quick question. Any update on the police officers that were injured while taking a shooting victim to the hospital last night?
Kumar, do you have anything?
Martin, I believe they were treated for minor injuries and released, but let us get back to you with the exact response for that. My apologies.
Martin, if you could again email the press account, we'll have somebody get back to you. And that concludes today's daily briefing. As a reminder, as was announced yesterday, effective this week, the city's COVID-19 press availabilities on Zoom will be on Tuesdays only, and additional avails may be held on an as-needed basis. If that happens, we'll put out an advisory that morning, but otherwise, Tuesdays only. Please continue to send all COVID-19 press inquiries to press@phila.gov. Our next briefing will be Tuesday, September 22nd at 1 p.m. Thank you.